Good morning, everyone. Warm welcome to everyone joining here this morning. I'm delighted to see all of you and see the interest in our topic of this morning on building health bridges for clean air, a webinar organized by the Health and Environment Alliance HEAL in collaboration with the Institute of Health and Environment Slovenia, and on the occasion of today's World Clean Air Day with the theme of Together for Clean Air. My name is Anne Stauffer. I'm Deputy Director at HEAL, the Health and Environment Alliance, and I'm joined here by several of my HEAL colleagues, whom you get to know in the course of this webinar. HEAL is a non-governmental alliance of over 90 member organizations, bringing together doctors, health professionals, public health institutes, patients, and health insurers, working for better health through a healthier environment in the European Union and beyond. And the Institute of Health and Environment Slovenia is one of our dear members. Our members include also European network as well as national, country, or regional level organizations. From the beginning of HEAL's founding 20 years ago, clean air everywhere for everyone has been at the core of our mission and of what we do. And in this 20 years, unfortunately, air pollution has lost nothing of its threat. It remains the top environmental threat to people's health in the EU, in the European region, and also globally. There's by now a huge body of evidence on how poor air quality harms health, the health of everyone, but especially those most at risk, including children, pregnant women, the elderly, those already sick, and those facing inequalities. And we'll hear more about the science in the course of this webinar. With all of the studies and of the knowledge gathered on the health harm, this all underlines the urgent need to act to swiftly and significantly reduce the unacceptably large health burden from air pollution. Because with the right political measures and the political will, these health impacts are actually largely preventable. We don't need to be facing them and we don't need to be suffering them. Many health organizations have now joined in the call for urgent action for clean air. The engagement of the health sector is actually at an all-time high, from the north to the south of Europe, the east to the west. And this is very much prompted by the overwhelming body of evidence, patients' testimonies, and also by the many people across the EU who are calling for clean air everywhere. So with this webinar today, HEAL and the Institute for Health and Environment Slovenia want to respond to this increased health engagement by creating a space for exchange, for building bridges, for health engagement and sharing. Air pollution knows no borders, and the same goes for our health engagement, for our working together for clean air. We're also organizing this webinar as we're in a key moment in the European Union, with decision makers negotiating a much needed update of EU clean air standards and setting the path for the EU to be the first region in the world to implement the new WHO air quality guidelines. And the health sector and all of us here in this call and beyond are working very hard to make the EU the front runner in better health protection. And you'll hear more of what is needed from our decision makers in the course of this webinar. I'm delighted that in our efforts to building bridges this morning, building health bridges, we're joined by outstanding health experts for presentations on the health evidence and on the country insights. But this webinar is also very much the opportunity for you, for everyone participating, to join the exchange by asking questions and sharing your comments and insights. And I'll get more to this later on how this can be done. And with that, I wish us all a fruitful exchange, and I'm handing over to my co-chair for this morning, Thomas Gorenz. The floor is yours, Thomas.
Thank you, Anne. Ladies and gentlemen, also good morning from my side. It's a pleasure to host such an important event on such an important day. So my name is Tomáš Gorenc. I'm a director of Institute for Health and Environment, which is a Slovenian non-governmental organization working in the field of environment, public health, and environmental health. The Institute is an organization working in public interest, committed to achieving sustainable development goals, and our mission is to ensure cross-sectoral collaboration, cooperation with various stakeholders in the field of health, of course, and environment. And with that being said, air quality is an important topic from a health and environmental perspective. More than ever, we have strong scientific evidence on air pollution, which causes premature death, poorer health, and creates billions of euros in healthcare costs. Therefore, it's crucial to revise also the EU clean air standards, which will culminate next week in the European Parliament. We need ambitious political measures to follow scientific evidence. And this year, International Day of Clean Air for Blue Sky focuses to need for stronger partnerships, increased investments, and shared responsibility to overcome air pollution. We need collaboration and partnership, of course, to tackle this challenge that has a huge impact on the natural environment, health, and well-being of the people. And now we will listen also to introduction speech from Vesna Marinko, General Director of the Public Health Directorate from the Slovenian Ministry for Health. So let's hear.
Ladies and gentlemen, good morning and welcome to this important international online event, Building Health Bridges for Cleaner Air. I would like to express my deepest gratitude to our esteemed partners, the Institute for Health and Environmental and the Health and Environmental Alliance for co-organizing this event. As we gather here today, we must recognize the importance of the issue at hand. Clean air is not just an environmental concern. It is a health crisis that affects us all. This event aligns with the European effort on the environmental and health supported by the World Health Organization. It aims to build stronger bridges between these two essential sectors for the advancement of our communities. Air pollution is one of the greatest environmental risk to health. It significantly increases the risk of cardiovascular and heart disease, stroke, asthma, lung cancer, and chronic respiratory disease. In European Union alone, air pollution is responsible for approximately 400,000 preventable deaths each year and incurs billions of euros in healthcare costs. A staggering 97% of the EU's urban population breathes air considered unhealthy by the World Health Organization standards. Poor air quality and its detrimental health impacts are largely preventable, and the current revision of the Ambient Air Quality Directive presents us with a unique opportunity to make significant improvements. Air pollution does not discriminate. Everyone is vulnerable to its harmful effects. However, the risks are particularly high for certain groups: our elderly, those already dealing with illnesses, pregnant women, children, and communities facing health inequalities. We must prioritize safeguarding this vulnerable population in our pursuit of cleaner air. The current revision of EU's clean air standards offers the European Union opportunity to improve air quality, which can lead to significant improvements in people's health and the prevention of numerous diseases. In closing, let us use this platform to foster collaboration and proper action to ensure that clean air is not a privilege, but a right for all. Together, we can build health bridges for cleaner air and a healthier future for our communities. I wish you a fruitful discussion today. Thank you.
Thank you very much. Thank you very much to the Slovenian Health Ministry for the welcome. And thank you also very much, Tomáš, for your introduction and welcome. Before we now start the exchange and the presentations, I quickly wanted to give an overview to everyone on the housekeeping rules. So Jacek, if you could please bring up the slide. Thank you. Indeed. So there, for our Polish audience joining this morning, we have simultaneous translation into English and Polish. So if you would like to listen to the specific translation, please click on the interpretation icon at the bottom right corner of the screen. I mentioned already that we do want to have an interactive exchange here this morning with all of you gathered. So please warmly invite you to put any questions you have on any of the presentation or any comments you have as well in the Q&A box, which you also find at the bottom of your right corner. And then Tomáš and I will have a look at your comments and questions and relay them to our panel later in the course of the webinar. It will unfortunately not be possible to ask questions directly with a microphone and the video. Yes, if you have any technical problems, please contact my colleagues Elke and Jacek for technical support, and you can find their names in the chat list. Yes, and the webinar will be recorded and published afterwards on YouTube. So we invite you to spread the word and share it afterwards within your next networks. And with that, thank you very much, Jacek. With that, we're now starting the exchange. And I'm delighted to welcome Sarana Anderson as our first presenter. Sarana Anderson is professor at the University of Copenhagen in the Department of Public Health, and she's also the chair of the Environment and Health Committee of the European Respiratory Society. So we're delighted to have you, Sarana, as one of the leading experts on this topic and present us as much as this is possible in the time that we have with an overview on the science and the evidence on the health effects of air pollution. Over to you.
Thank you very much, Anne, for a nice introduction, and thank you for inviting me to speak at this webinar today on the Clean Air Day. So I will talk about the overwhelming health evidence on the impacts of air pollution, and in this talk I will give overview of the major impacts on health of air pollution, and also start speaking about WHO air quality guidelines and a little bit in the context of the current situation now with air legislation and revision of air quality directive, which is ongoing right now. So I would just like to remind you that WHO has published a very important to our field summary of evidence of health effects of air pollution in 2021. And that piece of information was something that started revision of air quality guideline directive. So these guidelines really carry a lot of weight in our communication around health impact to EU, but also overall. So I would like to start a speech with just pointing out to some main messages from these air quality guidelines. So the guidelines provide a review of the evidence of air pollution health effects, and according to that evidence, they provide guidelines to what legal binding limits for air pollution should be in order to protect health. And kind of one of the main messages from this guideline now is that we got a very significant reduction in these limit values compared to what was existing from the latest review from 2005. So there was a big gap of 16 years since we did this last time. And now the main message, we have much more evidence now in the last 15 years. And if you see down here for the two main pollutants that we'll be speaking about in this talk and for which we know most about health impacts, for NO2, which is mainly related to traffic health effects, since it mainly comes from traffic exhaust, and PM2.5, which is kind of a garbage container of everything in the air coming from traffic, from burning coal for energy production, from industrial processes, from wood burning and coal burning at homes and so on. We see that the suggested guidelines were significantly reduced in the light of the evidence that we now know that level of these air pollutants is much more is dangerous at much lower levels that we knew in 2005. So this is one of the main messages. We went from 40 to 10 for NO2 and from 10 to 5 for PM2.5. So we have much more evidence to know that air pollution is dangerous above these levels, and these are now the existing recommendations. So what this means that we went from 10 to 5 in PM2.5, and this is the map of PM2.5 concentrations around Europe. This is from European Environmental Agency, is really the very appalling message that pretty much everyone is exposed to air pollution levels which are harmful to our health. Before this, our limit values were around 10, which meant that many countries around Western Europe especially have achieved the reductions reaching 10, even here in Denmark where I'm located. We're feeling comfortable with when we achieved reductions that now we are more or less clean, or we reached the levels that are not dangerous anymore. Now we are well aware that that's not the case. Air pollution is still dangerous around 10 and below, and for current levels in Europe, this means that pretty much everyone is exposed. 97.5% of European population is exposed. So we are dealing with a risk factor to our health that everybody's exposed to, and this really has alarming scale to us. So this is one of the main messages of these guidelines. Second, that there is no lower threshold below air pollution is safe. Of course, we do not assume that 4 micrograms per cubic meter is healthy. We just do not have that many studies that were conducted at these levels because very few populations are exposed to 4 and 3. But of course, we assume there's no lower threshold. The effects go down. Even small amounts of air pollution are harmful. So we should work towards reductions at all levels. And that is well illustrated in this curve. This is from one of our main studies that came out. This is a study of joint cohorts from around Europe, mostly from West Europe. Cohorts that you can see here on the range of exposure go to down even below 5 and show between 5 and 25. Just to remind you, 25 is the current EU limit value. The current Air Quality Directive sets limit value of 25. And the most of the European population that was part of the study is exposed to what is below current limit value and above 5. And we showed that there was this sharp curve shows that there's a strong association between PM2.5 and mortality, all-cause mortality, and shows that really this threshold goes below, there's no threshold, but also that we still have significant health effects below 25, which is now current limit value, telling us really that they're obsolete, that these current limit values don't work, they don't protect our health, we have significant health effects beyond. So those are some of the strong messages here. Another strong message is that health burden of air pollution as it is right now is huge. And it is actually increasing in the light of the new knowledge of WHO guidelines, which tells us that air pollution health effects are even stronger than what we'd known previously from the previous WHO guideline from 2005. And not to go down in details in numbers, but still we see now that the earlier estimate of 6.2 increase in premature mortality for each 10 microgram increase in PM2.5. This comes from summary of all studies on mortality and air pollution we had at the time. Now we summarize them again. We have many more studies, more inclusive studies from all around the world. We see that that estimate is about 33% higher. It's 8%. This is a significant increase. And of course, this translates directly to higher number of people or deaths attributed to air pollution. So we see that air pollution impact on our health is increasing, not before air pollution is more dangerous, but because we know better now. We have more studies, we have better studies, and we are better able to estimate the true impact. We see these are the numbers from WHO report, and we see that this means that we have more people dying due to air pollution when we implement this newest knowledge in our calculations of the burden. We also want to point out that after the WHO guideline, this was published in 2021, the review of evidence for this guideline, for this big and heavy report was done up until 2018. It takes some time to make this report. Of course, a lot of new evidence has come after 2018, and here we just want to point out that just only in Europe, if you look at the studies that were published after this 2018 21 guideline that we see actually the effects of air pollution even stronger. Again, I refer to this lab study that I just showed before. The estimate from the lab studies was actually close to 12%, so significantly stronger than 8%. And we still, on this graph, show you some of the other studies that were published in Europe after the guidelines, most of them also at very low levels from Scandinavian countries, and all of them point to stronger effects than what we saw in WHO guideline. So just to point out that the full burden of air pollution, even with these newest numbers, is that it even underestimated, although these numbers show us the very significant impacts and too large burden of air pollution. And the third issue I want to bring out, the WHO report guideline points out to, is that we have very clear links between air pollution and climate change. We need to combat these things together. There are same sources of air pollution that are most harmful to our health, that are direct causes of climate change. Those are the greenhouse gases. And some of the newest research also shows us that there are synergistic effects. The effects of air pollution on our health seem to be exacerbated and are even stronger in warm weather. And this study, Exhaustion, it is an ongoing study on climate change and air pollution interaction impact, shows us that the effect of air pollution on respiratory health, shown here, but the same is seen for cardiovascular health, that we see increased number of hospital admissions and deaths on the days with higher air pollution. That this effect of air pollution is much stronger on the days with very warm weather. And this is across all cities in Europe, from north in Oslo to south in Rome, and in the middle in Berlin, we see these effects. So this is really concerning to our health and pointing out that we need to do even more about air pollution to mediate impacts of heat and climate change on our health. So to go back to health, so we talk a lot about this premature deaths and impact on that, but we actually know that there are very many other impacts, milder impacts on triggering cough and runny eyes and so on in the people around Europe, to very serious increased risk of number of serious diseases that we want to talk about. And this is just a quick schematic, and I'll walk you through some of the main effects. There are many, many diseases that air pollution contributes to in adults, in children, in pregnant women. Before our birth, we're already impacted. And that brings out the scale. Everybody's exposed, and we have so many diseases that are affected by air pollution. That's why we have really a public health emergency about air pollution that we talk about. So if you go back and start with the lung, we know the lung is the first organ that has been studied about impacts of air pollution, because we inhale air, the particles, the gases that we inhale attack our lungs first, and we know most about effect on our lungs. And we know now that this long-term exposure to air pollution, the fact that we are exposed already in our mother's stomachs and as a children, air pollution affects our lung function and decreases the optimal growth of our lungs already in childhood. And that reduced lung function from early life affects our risk to develop asthma already in children, and throughout lifetime increases our risk developing asthma later in life, developing serious chronic obstructive pulmonary disease, also developing lung cancer. Air pollution is also carcinogenic. But also the newest evidence now, we also see the impact of infectious diseases of the lung, pneumonia, COVID-19, and so on. Global burden of disease have estimated and shown that almost 40% of all COPD deaths globally may be due to air pollution, and 30% of lower respiratory infections deaths could be to air pollution. Just to give you a scale, these are a significant portion of deaths from these major chronic diseases and respiratory diseases are due to air pollution. So there's a big prevention potential. 16% of all asthma cases in children are likely to be due to air pollution. So this is also a significant contribution. A part of this increased risk of these major diseases, many people with lung diseases daily experience exacerbations of their disease because of these short-term variations in air pollution. We experience short-term exposures if we are on the busy street during our daily commute. We can experience when we bike next to the diesel truck or busy street, or if you have several days of higher pollution episodes in the winter, which some cities experience really heavy days of a lot of air pollution, that really brings a lot of reduced quality of life, exacerbation of diseases from shortness of breath and need medication, but also very serious impacts as a need for emergency room visit, hospitalization, and it could even result in a death, as we have seen with a case of a small young girl, 9-year-old Ella Kisi Debra, that actually died of one of those exacerbations of her asthma in London in 2013. From lung, we go to the heart. We know now that the smallest particles can cross from our lung to our bloodstream, and from there can reach all our blood vessels and the heart and the blood vessels in the brain. And we know that air pollution also increases risk of these most serious cardiovascular diseases and contributes to death from them. And between 20 to 25% of stroke, ischemic heart disease deaths are due to air pollution globally. Also, in a similar way, air pollution increases inflammation of the fat tissue and contributes to increased risk of diabetes, and up to 20% of diabetes deaths are due to air pollution. It's also a very significant impact of cardiovascular disease. And just to point out to this recent umbrella review of all systematic reviews on air pollution and cardiovascular disease, just to show that we have really an enormous amount of knowledge now on the huge impact on cardiovascular disease, from hypertension to myocardial infarct, ischemic heart disease, atrial fibrillation, even in heart failure, some of the newest evidence. So impacts on cardiovascular system are huge and well documented now. From heart, I come down to cancer. Air pollution has been labeled as carcinogenic, both particulate matter, diesel exhaust, and a number of other components in air pollution by International Agency for Research on Cancer, EARC. These reports already exist for over 10 years. This is back in 2013. We have this report, which tell us that air pollution is carcinogenic. And this is really of concern to Europe, which now with the European Cancer Plan has been recognized that if we're really going to prevent cancer in Europe, we need to pay more attention to environment, which we haven't done adequately. And we know very well that lung cancer is linked to air pollution. About 20% of lung cancer deaths are due to air pollution, but we see also emerging research on other types of cancer, such as breast, liver, stomach, colon, and we'll see more studies likely, more cancer types linked to air pollution. And this is a big concern. So we see big potential with cancer and air pollution, and call for more research on other cancer types. Another areas of big concern for us is impact on the brain. We see now fast emerging evidence that air pollution impacts the brain development already children and contributes to non-optimal development of cognitive functions in children, learning difficulties, poor academic performance, poor IQ, as well as likely linked with ADHD and autism. This continues through our lifetime, and in elderly we see accelerated cognitive decline, which directly contributes to increased risk of dementia. And we have now actually enough evidence, and the recent meta-analysis on dementia shows this. And another concerning research results come on also our impact on emotional health, our mental health, and we see now a number of convincing good studies that show that air pollution can contribute to depression, anxiety, as well as increased risk of suicide. And this is through our lifetime. Many people in mid-age, young, old are affected by mental health issues, and this is also a great concern. COVID-19, I mentioned some of the new studies just coming out both from Sweden and Denmark and around the world at low levels, high levels, clearly show air pollution contributes to increased risk of COVID-19, both in children and post-COVID, long COVID, which Swedish study finds. So this is also very concerning and telling us that for infectious disease strategies, we need to also fight air pollution. Everybody's exposed, but not everybody is equally affected. And we want to point out that we really need to work to protect those that are most vulnerable, children, pregnant women, elderly, chronic disease patients, but also within countries in Europe and across Europe, East and West, which is pointed out, we see huge disparities in exposure, access to care and information, and we really have environmental inequality issues and opportunity to really reduce those inequalities by cleaning up the air. So to conclude, air pollution has huge impact on our health. A reduction of air pollution is a priority for public health. And right now, when we discuss reduction opportunity, we are discussing Air Quality Directive. We have a vote upcoming next week. And we see that this piece of legislation and hopefully full alignment with WHO guidelines, which is health-based, is a major public health opportunity as well as planetary opportunity that would for sure prevent substantial number of new cases of major non-communicable diseases. It will also make EU citizens more resilient to seasonal influenza epidemics as well as COVID-like new pandemics. It would improve life of lung, heart, and other chronic disease patients that daily experience exacerbations of their disease due to air pollution, and will indirectly benefit for health through mitigating climate change impact on our health, as we see through heat, through interactions of heat and air pollution on our health, and not to mention the wildfires and other and related air pollution episodes that we see through climate change. So with this, I will conclude and open up for any questions.
Wonderful. Thank you so much, Sorana, for this compelling overview and walking us through on the evidence and underlining again how we're all breathing in air that is harmful to health. We're all at risk, but some are more vulnerable than others, and also showing what is needed on advancing us towards clean air. You mentioned it in your presentation already, but we did have a question from our audience on the link between COVID and air pollution, and specifically on PM 2.5. So I wanted to ask if you could elaborate a bit on the studies that you mentioned. Thank you.
Yes, very much. So COVID-19, early on, we've seen links between COVID-19 and air pollution when we saw the big COVID tragedy in Italy and areas with higher pollution in northern Italy especially. So we had speculations early on that air pollution may be transferring COVID, increase our risk of infection. So this research agenda has been really active, and now after 2-3 years and really good data and individual level studies, we actually have convincing evidence across from Europe to UK, through Denmark, from Italy, from Spain, and we clearly see a link that air pollution increases risk of our getting COVID as well as having poorer prognosis. We see that air pollution is clearly linked to increased risk of being hospitalized and dying from COVID. So this is really concerned findings. And the study from Sweden that I mentioned at very low air pollution area, with the data on young adults and post-COVID symptoms, we also saw the air pollution also increases risk of those. So we see that air pollution both likely reduces our immune response, making us more vulnerable to contract the virus, but also to develop more severe COVID disease. And this translates to us, COVID, of course, is important, but also to other respiratory infections. It's exactly the same mechanism, and we see also more studies now on pneumonia, influenza, and we still have seasonal impacts, and many people die every winter from pneumonia. So this is extremely important. An additional argument for us to do more about air pollution, because this would also reduce impact on these respiratory infections that we have many deaths and a lot of health care costs from.
Thank you very much, yes, for this explanation, which shows again, as you say, the link to infectious diseases, and then also following from your presentation, the clear link with chronic diseases that we're seeing with air pollution, which I think all taking together really, really underlined the need to act and to make clean air a priority. Thank you. We're now moving on in our webinar, and I would still like to encourage our participants, if any questions now come up after this presentation, as you're still digesting, don't hesitate to ask them in the chat. And Sorana, you're still with us, so we can also come back to that. We're now moving on to a round of country insights. We wanted to have a roundtable as part of this webinar. As I mentioned earlier, that the health sector engagement is at an all-time high across the European Union, from the north to the south to the east to the west. And we wanted to use this morning for sharing some insights on some specific countries in terms of the air pollution burden, air pollution and health burden that we're seeing in the country, and also the health sector. And I'm delighted that we have several experts here with us this morning. And I will first now open the floor and turn to Bulgaria for a country insight from Bulgaria, and very much welcome Alex Simichev, who's a member of parliament. And I understand you're leaving your parliament session to be with us. So that is very much appreciated, Alex, that you find the time. And also congratulations on being elected a member of the Bulgarian parliament. You're also the co-founder and the president of Air for Health, which is a nonprofit association working to engage the Bulgarian health sector for clean air. And so the floor is yours in terms of sharing your country insights from Bulgaria. And you're muted. We can't hear you.
Thank you very much,
yes.
Anne. It's a pleasure and a privilege to be able to talk on this session and on this panel. I wanted to share several insights around both the birth of our local NGO Air for Health, and also what we believe is an extremely important element of building bridges around the whole ecosystem related to air pollution, because it's an issue which is both very pressing and very important, but also it's an issue which is a little bit out of mind for a host of institutions. It's very much central to the population and to the communication with the people, but it's not very central to the institutions, which work relatively siloed in their respective areas of expertise. I'd like to share several important insights. First, when we started Air for Health, we thought that it's relatively easy to talk about the health consequences of air pollution, but actually that is not the case. And the reason for that is that when we start medical school, we start talking about public health in the first years of education and end up with clinical teaching at the end of the education, which means that most of our physicians end up being disease-oriented. They want to diagnose disease rather than prevent disease. And that was an important insight which kind of shaped where we want to go with our organization. Internally, we have several relatively unique elements organized in our Air for Health Association. First of all, we started working with the institutions. That was partly because of my role in Parliament. In the last 2 years, I've been elected into Parliament 5 times. We changed 5 parliaments, which means we have a relatively very unstable political situation. But that gave me the opportunity to kind of look at the bigger picture and how institutions are working. And I saw that 2 important institutions are usually not parts of the solution together. They're siloed and they're part of the solution, each in their own part, without interaction between them. And that is the Ministry of Environment, with measurements and strategies for air pollution reduction, and the Ministry of Health, which was more around diagnosis and actually conceptualizing of activities around the healthcare sector, which is why when we wanted to talk to them together, we organized a meeting between the 2 ministries and our association, where we signed a memorandum of understanding and a memorandum of agreement between both the Ministry of Environment and the Ministry of Health, together with our association as an expert group which can support the activities of both the Ministry of Environment and the Ministry of Health. That was the institutional part of our activities. On the second part of our activities was the work with professionals, with healthcare professionals, both at the physician level and also at the nurses level. And interestingly, because of our insight that healthcare prevention is not top of mind for many clinicians, because we organized a network of physicians across the country. We have more than 40 clinicians being ambassadors of clean air around the country. But the problem is that in themselves, they're very busy with their clinical work. They don't actually have such a preventative attitude. And we thought what if we go earlier in the educational cascade of a physician? And so we actually made a network parallel to the healthcare physician network. We made a network of medical students. And it's very interesting because this is probably one of the most effective ways to approach medical professionals when we engage them early on during their educational cascade. And we have students from the second semester onwards, which are part of our student network, medical student network, which we believe has probably the highest potential of achieving lasting change on the air pollution agenda. And that is actually approaching strategically physicians and healthcare workers at a very early stage when they have not been shaped with the purely medicalized approach to air pollution, which is, let's look at the consequences or the harms which have already been achieved, but rather take a more preventative approach with the very young physicians. On top of that, so we have the institutional elements with the ministries, we have the physician elements with the students and the physician network. We also have a third focus, which is around communication and the media, because air pollution usually becomes a problem either when the air pollution is very high or when somebody has achieved some kind of harm. We wanted to give journalists and members of the media a possibility to learn from the best. And so we organized activities with journalists where we could share our approach towards air pollution and the prevention from air pollution consequences to journalists, allowing them to ask questions not in an interview fashion, but rather in a mutually educational approach, both us educating them around the harms of air pollution and they educating us how we can better communicate what we know to the wider population. The fourth element, the first being, again, institutions, the second being healthcare professionals, the third being the media. The fourth element is interaction with our fellow NGOs, because that interaction has been very critical for our survival as an association. One of the first memberships we achieved was several years ago when we became members of the Health and Environment Alliance. So HEAL has been very instrumental in our survival locally in Bulgaria, and we want to thank them for that. But together with that, the Clean Air Fund, the Friends of the Earth, Healthcare Without Harm, we have been very active in communicating in all directions externally, but also internally with the local members of the NGO community in Bulgaria, which is Friends of the Earth in Bulgaria, which is called Za Zemyata, together with the Worldwide Fund, so WWF, also being an active interaction. And because of my previous kind of inclination towards grouping people who think about the environment, we are also a member of something called the Climatologists Anonymous, which is a think tank, a local think tank in Bulgaria around climate change, where I have personally done several talks on the links between air pollution and climate change from a healthcare perspective. And they were very insightful because people actually need to materialize, to see the benefit, respectively, the harm of air pollution. And so we have also been very active in making bridges around the local NGO community. Last but not least is the academic sector, which lends credible evidence, but also allows us to use leaders of our local academic institutions to be able to communicate the agenda. And specifically, one of our universities, Plovdiv Medical University, has been very instrumental with Professor Jambov being a local opinion leader who is very vocal around the topic of air pollution and health, also noise pollution, climate change, etc. But the topics we have always been building from the inception of Air for Health until present day has been building bridges around all of these elements and bringing them together like a jigsaw puzzle so that we have the bigger picture in front of us. This has proven to be very effective. I know that today is the Clean Air Day for Blue Skies, but what we have done is we have made an event on Sunday, because on Sunday, more people of the population in Sofia are free, and we have made an event, a very big event in one of our largest parks, where we invited members of the academic institutions, from the Cardiology Society, from the Lung Society, also our fellows from the NGOs, and we have invited journalists together with the municipality in Sofia to celebrate clean air in front of the new season and in front of the fact that Sofia municipality will soon be establishing a low emission zone, to be able to communicate the topic in a very fun kind of way, make arts and air pollution work together. We invited one of our very famous wind instruments orchestras to be present at our event, so that we will be sharing this and you will see it on Sunday. Wind instruments which actually make arts out of air. So with this, I'd like to end at this point, and I'm open for questions if you have any specific questions on the way we have built bridges around Bulgaria and also with the EU.
Thank you very much, Alex, for these insights and also sharing of good practice and inspiration to our health representatives in this call. They're all great things. I'm especially intrigued what you mentioned, that you got both the environment and the health ministry together, and you got them to sign a memorandum of working together. That is, yeah. And if you can share, any further insights on that, that'd be great, because I know you have to leave soon. So I would just take this question and then we continue. Thank you.
There was a small hack around this, because if I was not a member of parliament, this might not have happened as quickly as it did. But because at the time I was member of parliament and I could talk to the healthcare minister and also the minister of environment, it was easier to kind of organize the two ministries to send representatives at a single date and at a single place, and so facilitate the talk between them. Interestingly, they continued that talk on an institutional level, even though we were not part of it. So they saw the benefit of actually working together as institutions, which they had not seen before that, because at least in our country, ministries tend to silo themselves, because they think if we take another ministry in, they will only give us additional work, instead of the fact that actually we can do much more work when we use expertise between the two ministries. So it was an insight for them to be able to work together and to solve problems on a much better scale. For example, all of the Ministry of Health has regional representation in each of our national regions, where they have an annual report on air pollution and health, but that report was not being shared with the environmental ministry. Similarly, the environmental ministry has a report on the quality of air, but the Ministry of Health was not receiving that. So being able to just bring the two together, even if we did not sign a memorandum, would have been great, because they saw the benefit of actually working together. The added benefit was that we were able to draft up and coordinate with the two ministers, with the respective ministers, a memorandum of agreement where we as Air for Health were seen as experts in that specific topic of the intersection of air and health. And so the Ministry of Environment can use us to communicate and also to give expertise on health-related topics. And the Ministry of Health can use us to bring in expertise from an environmental perspective. So it was a very successful meeting at that time, and the memorandum has been signed by the Ministry of Health. I will be receiving it in 1 or 2 days. And the Ministry of Environment is in the final stage of coordinating internally, because large bureaucracies, institutions work quite slower than NGOs work. So, but we will be getting it at the end of September, the memorandum, and from the Ministry of Environment also.
Thank you very much. Thank you for sharing your insights and for your time this morning. And then I know you have to drop out at some point. So thanks for being here. And I'm handing over to you, Tomasz.
Oh, thank you. So we will continue with country insights, and we are going from Bulgaria to Ljubljana, Slovenia, to the medical faculty, where we have representatives from academia. So warm welcome to Dr. Andrea Kukec, Assistant Tanja Rejec, and Assistant Researcher Aida Mlakar. So please, the floor is yours.
Well, thank you very much, Tomasz, and also organizer for your invitation and opportunity to share with you our research. The point of view is that it's research with a collaboration with clinicians, and Aida and Tanja will present asthma research and sleep research. So I please you, and if you have any question, then you are very welcome.
Thank you so much. Hi, my name is Tanja Rejec. I am a teaching assistant here at the University of Ljubljana at the medical faculty. Here with me is Aida Mlakar, who is also a teaching assistant here, and together we are doing research. And today we would like to present you what we are currently doing regarding the asthma prevalence and sleep quality in association with the environmental risk factors. So if I start with just a little brief introduction, so we all know that asthma is the current evidence suggests that asthma is a complex multifactorial chronic disease with the etiology in many different points, as being the genetic susceptibility, host factors, and of course, the environmental exposures, which we will talk a little bit more in detail today. So the asthma is also the most chronic disease in children and also the most common causes of hospitalization of the children of worldwide. Asthma is also the most, can we go? Okay, sorry. I click it forward, yeah. The evidence suggests also that despite the improvements in pharmacological treatment, the prevalence of asthma continue to increase worldwide. So talking about the asthma prevalence, it was quite hard for us to get the data that we wanted, because we want the data for a specific for each country in Europe. To see how the prevalence it is, and we didn't get this information, but the information that we got is from the ISAC study, which you all probably know. This is the International Study of Asthma and Allergies in Childhood, and it indicates that the prevalence in children, but we have to be here careful, because the prevalence of asthma symptoms, thus being wheezing, not doctor diagnosed asthma, but the asthma symptoms. So this, the prevalence of this is in children around 12% and in adolescents around 14%. So here you can see the pictures from the data ICHME, the GBD compare database, from the year of 2019, which indicates the asthma prevalence in Europe among children and adolescents between 5 and 14 years old, that being approximately 6.3% of all prevalence. And on the right side, you can see the burden, specifically the dailies, for the asthma in the same population in the same year, being around 4% of the total burden. So we would like to point out, of course, the environmental factors associated to asthma prevalence and asthma exacerbation. And as we already heard before in the previous presentations, we can see that many researchers associate the indoor and outdoor air pollutants to a number of respiratory diseases, such as impaired respiratory development, increased risk of respiratory infections, risk of developing and exacerbating already existing chronic disease, or developing a new chronic disease, and so on. Studies has also found that children living near pollutant environments, for example, in approximation of, know, 200 meters from the very busy roads, have a statistically significantly more likely to develop asthma compared to children living in less polluted area. So we can also observe in the studies many researchers that are pointing out that it is necessary to control and manage the environmental component of health risk factors in order to control and reduce the prevalence of asthma and also the exacerbations and development of new respiratory diseases. So taking all this into consideration and taking also into consideration that asthma prevalence in Slovenia is quite not rarely measured, but the data is really old, from 2002. The study was made from colleague, what's his name already? Okay, yeah, it is Kopriva and his colleagues, and it is very old. So we decided to do a new study and to associate the asthma prevalence with the environmental risk factors. So this is the aim of our study. The type of our study that is currently ongoing, we already started, is a cross-sectional national study type of HIS and HIS, thus meaning the health interview survey and health examination survey. The population, observed population are children between 6 and 7 years old and adolescents between 12 and 13 years old. Here in Slovenia, this means the 2nd and the 7th grade of primary schools. We calculated also the power of our study, and we decided that we want to have approximately 3,000 of included children and adolescents altogether. And the observed unit are schools, so we calculated that this would be approximately 70 to 75 schools that we have to take into our study. These schools will have to be evenly distributed across the geographic region of Slovenia, which is the 12th geographic region. So the period of the study is from January this year, and we intend to end it in June next year. And the method for the data collection, as I already mentioned regarding the type of the study, HIS and HIS type, is from the HIS type of the studies questionnaires, and for health examination survey is health records, which we will observe the specific health outcomes, of course, in regarding to consent from the parents to look into child health records. Our research was also approved from the Ethical Commission of Republika Slovenia under the academic research. So taking into consideration the environmental part, so the environmental health risk factors, how we will be able to find this and associate it with asthma prevalence is in the first part of the study, so in the HIS part of the study. So we formulated the new questionnaire in which we took into consideration 3 previously already used questionnaires, but we updated them. We put some new questions in and upgraded to target more specifically what we wanted and to target more specifically each environmental factors that we want to. So questions in our questionnaires are targeting many points, and thus being child in general. Here we consider the age, the sex, and the address. Why the address? The address is important because we further on intend to connect the data also with the routine data from the air pollutions that is routinely monitored in Slovenia in 21 stations. So the next point is general health status that we want to know, And then, of course, asthma symptoms and asthma diagnosis and allergy diagnosis and allergy symptoms. And then further on, information about the premature exposure to risk factors. So this being, was mother exposed to some specific environmental factors. And then the information regarding the birth. Thus being, was the children prematurely born, or he was normally due to date, or he was overdue. And then early exposure to risk factors of child and current exposure also. The next one that we wanted to take into consideration is also the genetic tendency towards asthma. And then, of course, the current exposure to environmental risk factors regarding the air pollution, air quality, as well as indoor, as well as outdoor. And then the building characteristics and exposure during various activities that could exacerbate or influence the asthma symptoms. Regarding all, we want to measure the exposure to mold and dampness, to traffic-related air pollutants such as CO, CO2, VOCs, NOx, PMs, and so on, the standard ones. And then the pollutants from cooking and heating, PM, NOx, and so on. And then exposure to VOCs, formaldehydes, phthalates from the home, so from the built environment. Thus, taking into consideration the home renovation, the new housing materials, the cleaning products that they are using, and so on. And the one important one is exposure to cigarette smoke. And this is also exposure to cigarette smoke premature. So was mother smoking when she was pregnant, and then exposure in early age of the children. Was he exposed to cigarette smoke? Was she exposed now? Is she not exposed now to cigarette smoke, and so on. So our questionnaire was already content validated and already used in the pilot study. And then, after all, the final version was already made. So regarding the data collection, I already explained how we collected the data regarding the type of survey that we are ongoing, that is ongoing. And then I would like to emphasize our observed outcome being the asthma prevalence, but being considerate with the two aspects. The first one is the current asthma cases reported by parents. So we will take into consideration of course, the children that has asthma diagnosed by a physician reported by parents, and the parents had to have the positive answer to a question: does your child currently have doctor diagnosed asthma? And then the second one is from the medical records. So in the medical records should be evident that the child was already diagnosed with by pediatrician with asthma. So, but there are also cases where we can see that the child doesn't have the diagnosis, but has a significant some parts indicates that he could have asthma. So these cases will be furthermore evaluated by the pediatrician, and then taking into consideration these cases, the pediatrics specialist will look into these cases and decide if they have asthma or they don't have asthma. So as I mentioned briefly before, we already made a pilot study in 2 primary schools. In primary school here in Ljubljana, primary school of Karel Destovnik Kajuh. So the school is situated here in Ljubljana in the urban area, and the second school is primary school Spodnja Idrija, which is located in suburb. So we have urban and suburb or village city where we take these 2 schools. So the approach that we took in the first school was that the class teacher distributed the questionnaires, and then the parents fulfilled the questionnaires, and the questionnaires were delivered to us, and then we proceed to make a database and put the results in this database. And then in the second school, the approach was that we went to the parental meeting, and at the parental meetings, we explained a little bit about the research, what we are doing, why we are doing it, and how we are doing it. And then the parents fulfilled the questionnaire there at the parental meeting. And evidently, the response rate was much higher compared to the first approach. But now we decided to leave. It's up to school how they wanted to be approached. If they prefer one approach over the other, we are going with it just to have the sufficient number of included children and adolescents in our study. So until now, we don't have any reported diagnosed asthma, but we have many reports by of a few of symptoms that could indicate the potential asthma cases. So these, as already mentioned, will be reviewed by pediatrician together with the other health records that are in the health records point of the health record system. Yes. So I told you a little bit about the asthma, but one aspect that is already really important regarding to health and of course connected to environment is also sleep. And this is my colleague who will explain you a little bit more in detail about the research that we are doing regarding the sleep.
Thank you. So as my colleagues previously mentioned, in the last year, we also are targeting sleep research because the lack of sleep and its poor quality is one of the major risk factors for different medical conditions and diseases. So poor sleep quality can result in pain, chronic obstructive pulmonary disease, also asthma and allergies, and chronic kidney disease, diabetes, and different psychiatric disorders. We all know that we can measure sleep in 2 different ways. So we can measure it objectively with polysomnography or actigraphy, and subjectively with questionnaires and scales. And in Slovenia, we do not have validated measurements, so subjective measurements like questionnaires and scales for sleep assessment. So the aim of our study is to develop and validate questionnaires to assess quality of sleep and the different risk factors in the population of adolescents. So we decided that we need to assess different types of risk factors for poor sleep quality. And we divided it into 4 different groups. So we have biological risk factors, such as previously existed diseases and medical conditions of adolescents. We will ask them if they are taking any medicines or nutritional supplements, because this also can influence the sleep quality. One of the major biological factors are also hormone levels and circadian rhythm for each individual. Then we also have to check for different psychological factors, such as interpersonal relationships in the family and in the school, and also stress symptoms and symptoms of depression and anxiety. We will check for the socioeconomical factors, such as if the adolescent has their own room, or they need to work from home or at home, at the farm or something like that, or if they need to student work to pay for their own bills. And we also will check for different environmental factors. Environmental factors are, for example, sleep hygiene. So are adolescents smoking, or are they drinking too much caffeine or alcohol? And we will check for the indoor air quality, noise, room lighting, and room temperature, because these 4 are 4 objective things that can influence the quality of sleep and lack of sleep. Also, this research is already approved by medical commission for the ethics in the Republic of Slovenia, and we will start to collect data in the January next year. So thank you for your attention.
Thank you. Thank you for interesting insights. Now, as I can see, I mean, really important part of this presentation, and since I'm also from Slovenia, is again data. And Slovenia is really interesting country because it's really hilly and the landscape is really diverse. So it's really important to measure data, and also this air quality directive is, I mean, part of this air quality directive is also related to monitoring. So we need to monitor it if we want to take measures, especially when we talk about these vulnerable groups. So this is really important aspect of that as well. And on the one hand, we know a lot about air quality, indoor and outdoor. But on the other hand, we still need to learn a lot. Also, sleep is one important part of that. So yeah, thank you for now. Now I would like to go to Poland, and I would like to introduce Weronika Michalek. She's a director of Heal Poland. She's working to raise awareness on the health effects of air pollution, engaging the health sector and communicating on clean air for health. She is also frequently interviewed in Polish media. So Weronika, please.
Hello to everyone. I'm very happy that I can join this webinar and present Polish perspective. Ja będę mówiła w języku polskim, so I will speak in Polish. My presentation will be translated by the interpreters. The presentation is mainly in Polish, but I will be happy that the interpreters will translate it to English. I made English subtitles. Tak jak powiedziałam, będę mówiła po polsku. Bardzo dziękuję za możliwość uczestniczenia.
I'm going to speak Polish, so thank you again for having me on this webinar. I'm going to share my screen, and please let me know if you can see it.
Yes, perfect. We can see it in presentation mode.
Świetnie, bardzo dziękuję. Proszę Państwa, usłyszeliśmy kilka bardzo ciekawych prezentacji.
We have heard very interesting facts. I've been very carefully listening to your outcomes, to your research, very different perspectives from different countries. So it was a great introduction to this roundtable. Let me share the Polish perspective, one of the most polluted countries in the European Union, particularly when it comes to air quality, and pollution concentrations in Poland reported are more or less the same as the top most polluted countries or capitals in the world, in Asia and elsewhere. I'm not going to go into details about scientific research. Instead, I will try to give you a picture of how we approach health issues caused by poor air quality in Poland, how we understand it, and how HEAL tries to involve or tries to trigger a discussion in the health sector in general. Let me say first that air pollution in Poland is a problem indeed. I think the most burning environmental problem we are struggling with, based on various estimates, based on various methodologies, we can say that air pollution in Poland contributes to between 36 to 56,000 premature deaths a year. This is really a lot. This is average-sized city or town that just disappears from the map of Poland because people die due to poor air quality. And this low-stack emission idea this is related to stoves in private houses, to heating systems, mostly powered by hard coal, because it is hard coal that is to blame for poor air quality in Poland in the first place. So even up to 22,000 deaths, premature deaths in Poland, is caused by low stack emission. It's not easy to measure the total costs of air pollution. Much depends on entry data, but it's between 300 and 800 euro a year per person, the cost of health issues, health problems caused by poor air quality. Some main sources of pollution in Poland, this little house icon is households, the burning of coal, of wood, of pellets in stoves. This is one of the key reasons for poor air quality in Poland. We still have few million, more or less 3 million households in Poland that are ineffective in terms of energy and heating. Then we have transport and nitrogen oxides. Of course, this is a problem in bigger cities. During small episodes, this nitrogen dioxide reaches top levels, record levels, especially in winter seasons. And again, Poland has relatively high rate of vehicles per inhabitants. Many cars are imported to Poland as second-hand old cars, and they really contribute dramatically to poor air quality. And finally, power plants, power generation, more than 70% of electricity generated in Poland comes from the burning of hard coal. So this dependence on fossil fuels also contributes to poor environmental air quality. And finally, we have farming. Although this is not the main focus, this is where ammonia, in particular, is a problem. This year, together with the Polish Smog Alarm NGO, we have prepared an analysis following WHO's recommendations, an analysis of the winter season in Poland, because this is where emissions really reach record heights, because people heat their homes in winter. And we measured the level of pollution compared to WHO's recommendations. So the study covered, the analysis covered 4 months from October to March. As you can see in this picture, we have places with the number of days with top pollution with PM10. And WHO says it should be 4 days a year where the PM10 can exceed the recommended level. So it's even up to sometimes 50, 60 days more compared to WHO's recommendation. As it says below the picture, out of 211 towns that we covered by this analysis, as many as 180 did not really live up to the recommendations of WHO. And the worst case is even up to 100 days, and it's only for 6 months that we covered with the analysis.
And the next slide presents PM10 during the heating season. So on the average, 10, the highest 208. 45 is the maximum recommendation according to WHO, and I'd like to refer to the comment that I've seen during the webinar on how about PM 2.5 is. It is more harmful, I agree with this, and I believe that these concentrations are pretty high. Mainly PM10 is taken into consideration. This is very bad for the health. And I'd like to draw your attention to the fact to aromatic carbohydrates like benzoappearance. So the guidelines of WHO when it comes to BAP, that is cancerogenic and mutagenic, are much higher than the European Union's 1 nanogram. Red dots indicate the highest concentration of BAPs. It is a map of Poland that is marked with red dots. So, south of Poland countries, there you can see local high concentrations of BAPs. Northern Italy is on the map too. What is worth mentioning here, this is 2021 data above 1.5 nanogram. In Poland, we often speak 9, 10, or even 11, or as much as 14 or even 18 nanograms. So this is number of times exceedance of the concentration of this hazardous substance, which has been indicated as carcinogenic in a number of research. Clean Air Day is what we celebrate today, the Blue Sky Day. So, ladies and gentlemen, have a look. It's 11:20 in Poland. These screenshots were taken 20 minutes ago. I just put them into my presentation. Before my presentation, Jacek helped me. He's attending the webinar too. And it shows us that during the summer season, when the smog season does not impact the situation that much, we don't have to use coal to heat up our houses. The air quality is presented in the beamer. Warsaw, the first one, PM10, 77% exceedance. NO2 from transport, 308%. And the following one, Łódź, fourth largest city in Poland, third or fourth. It changes over time. One of the biggest cities in Poland with 1 million inhabitants, the concentrations highly exceed. Look at NO2s, 366%. This is the spot concentration compared to standards. Kozie Głowy, Silesia region, it's a record breaker, 583% above the threshold for PM 2.5. I won't be reading out the data. Just have a look. Silesia, Katowice, last but one, and Krakow. These are based on early app. It's not the data from the state monitoring. The app is ongoing data provider. These measuring stations have not been certified by the state, but we use them often in order to learn about the up-to-date state of things. All instances, first, second, and the fifth, negative impact of air pollution on your health. And the midsection of the beamer, Kozie Głowy, very much polluted. It's danger for your health. So it's Poland's reality. It's beginning of September, quite a warm day, 20 plus degrees centigrade. We have analyzed the recent smog season in Poland. Not only did we look at the levels, but also the impact in short-term and long perspective on health. What we want to indicate in debate and narrative is that it does not have to continue for months or years when we live in the cities, some towns that are very much polluted. It can be few-hour impact. If you stay a few hours in a place that is heavily polluted, remember the first slide, and there's nothing compared to winter season. Short stay may result in problems like poor well-being, allergy, headache, cough, shortened breath, chest pains, lack of oxygen, feeling of dyspnea, as far as lung inflammation, cognitive function, distortion, heart rhythm change, or heart attack or cardiac arrest. So these are the ones that we have to cope with in Poland. And our lungs and our body are not more resistant compared to those who live in other parts of Europe. So we risk our health on day-to-day basis, especially risk of children, as much as the risk for pregnant women and elderly people. May last year, this was the time when we had the first official diagnosis in a child. There was a responsible doctor who diagnosed this disease that was smoke dependent, air pollution. So it's 11-year-old Maciek. He's been ill for years. Winter season is the time when he's got stronger symptoms, respiratory symptoms, or asthma. So this is allergy or increased lung activity that is related to smoke. We reported this to the media because it was the first time we've ever seen this clear dependence. During the webinar, there was the history of a girl. She's a London inhabitant. She died because of the air pollution. In Poland, many children suffer from bad air too. In all Polish media, this information was presented. We've got the information that more doctors think about connecting a diagnosis with air pollution, mainly in children. So this is not the end of the story. This is just the beginning. These illnesses will be classified and there'll be a clear indication with health problems. And 2 words about medical sector's involvement. It's our center of interest. HEAL works with health protection sector, and we request them to air out their opinions and comments on state of things and their opinions with regards air pollution. I won't be reading out the quotations. The presentation will be available later on, and interpretation and translation whenever required. But there's a group of representatives of health sector who openly say that air pollution is a big problem in Poland, and they give the reason: coal, fossil fuels that we should phase out, incineration of solid fuels, and the groups that are most vulnerable to these pollutions, especially children, because we focus on children to a large extent. This year, we had 3 publications on how harmful it is to incinerate coal in long-term perspective and health benefit when we turn our back on coal incineration. And the publications that were mentioned in the previous slides, so the previous smoke season's impact on our health, short-term impact and exceedance that was mentioned at the beginning of the presentation, and the scientific review of air pollution with NOxes, so transport emissions. And the last slide, involvement of health sector representatives. This is Doctors for Climate initiative that was launched 3 years ago. We've got dozens of signatures. We have a working group, experts from the health sector, many professors, doctors, and renowned institutions, universities, health providers of all kinds. Doctors for Climate, this is the objective of this group, but we highlight the importance of air pollution for health. We are very happy to see so outstanding personages from the world of medicine to support us. They support all of us at our attainment to provide better air. I hope we'll be speaking more and more about it. And Poland implements this revision, may be ambitious, on health quality. Poland becomes a much cleaner country. We won't run the risks of dozens of thousands of lives that are lost because of poor air quality. We've got the tools, we've got the database. What we want is the political will to spare the act so that we make the most of the tools that we have to make the air cleaner. Thank you very much for the presentation and the participation in the webinar. If you have any questions, I'm more than willing to answer them later on.
Thank you very much. I'm looking in the chat box. Is there any other questions so far? I have here a quick one related to children. Okay, Irene has a question.
No, sorry. Go ahead, Thomas. Sorry.
Okay, so I have a quick question here related to children. They are often super spreaders. What do you think about that? Is this a specific question to anyone of the panelists? Maybe want to respond? If not, we can also write an answer in the chat box. But anyway, I'm just asking myself if there is anyone who want to respond to this question, or the panelists, before we move on.
Jak rozumiem, to dotyczy bardziej kwestii rozprzestrzeniania
As I
wirusa.
understand, it is virus spreading question rather than air pollution. So I could refer to air pollution, of course. In the situation as we have in Poland, air purifying devices are very useful, but I don't have competences to speak about spreading viruses and air cleaning devices to stop the process.
Okay. Thank you for your response, Veronica. And I would give word now to Anne to continue our webinar.
Thank you, Tomasz. We're now walking the bridge from Poland to the south of Europe to Spain, and to hear from Irene Bernal from Salud por Derecho. Irene Bernal is the Advocacy and Research Manager at Salud por Derecho, a Spanish non-profit foundation that defends human rights so that all people, wherever they live, can exercise their right to health. And Irene will give us the update on air pollution and health in Spain, and also talk to us about the Spanish EU presidency, since we're currently in the time where Spain holds the EU presidency. Over to you.
Thanks a lot, and thanks a lot to Heal for inviting Salud por Derecho to participate in this very interesting webinar. This is a very special day. So I will now share my screen just to confirm that it's okay and everybody can see it.
Yes, we can see it. Thank you.
Great. So just briefly, because I don't want to take much time. Salud por Derecho is engaged on health and climate change a couple of years ago. We've been deeply working on global health since a couple of decades, and moving on the different dimensions of the impact on health. We engage on health and climate change, and especially also more recently on health co-benefits and focus on air pollution. So I'm just going to give you a brief presentation, in this case more focused on the public policies, and with some relevant data that I thought that might be interesting to highlight, but especially to focus on what is supposed to come out from the Spanish presidency in terms of equality. So I will just move. This is just for you to give you at a glance Spain, it has the legal framework that we deal with. It comes obviously from Europe and from both directives that right now are currently under revisions. So this is it's been the frame used from the public policy space and transposed to the Spanish legal frame and Law 34/2007, which is basically the core of all legal actions and political actions in Spain at national level, but also at regional and local level. And basically, the compliance with this law, it's what is basically setting up the actions that the different governments, different levels are taking and moving on. How this compliance is done is basically what civil society is doing, trying to follow up and trying to track how much and how far the decision makers are going on its implementation. So this is basically for you to have a slight idea of how we move on in Spain. The Law 34/2007 it basically covers the entire protection of atmosphere and whatever it goes around this issue, as it is stated, it's basically empowers the government to go and to cope with, I would say, two main issues, two main core issues. One is to define plans and programs, and secondly, it provides the need to track from the civil society what is happening, and it also it includes the air quality index, and it's been updated with several orders and royal decrees that it came afterwards. But it's the current frame. From this law, it generates two basic tools in Spain, which is the National Air Pollution Control Program, which is basically it comes from air quality plans in the past, and the National Integrated Energy and Climate Plan, which is basically now under review, and it mainstream air quality, whether it's enough mainstream in terms of health. This is basically the core of the discussion. So the government launched July of this year the report evaluating the air quality in Spain from 2022. The data that you see here, it was launched in July and is going to be reported to the European Commission by the end of this month. So this is the more recent data coming from the government that we have stated it in a document, and what is going to be reporting very soon. This is just for data that I thought that it was probably the most relevant. 17,000 premature deaths due to exposures to fine molecular particles, almost 5,000 due to NO2, and more than 2,000 for O3, which is O3 is one of the more worrisome topics here back in Spain. And then, of course, it's very more relevant when it's measuring years of life potentially lost. So it is stated in the document, which I thought that actually was quite important, that actually the air pollution and its impact on health, it makes the most dangerous environmental factor for human health, together with unhealthy diets and tobacco consumption. So this just wanted to highlight especially these numbers. According to the data that is reported from the government, basically what according to EU rules, which has been transposed to the Spanish legal frame, as I mentioned before, everything is okay, except in NO2 for Barcelona, which is quite recurrent from the last years. And also we have a surprise in the case of NO2 for Madrid, which threshold it has not been exceeded, and according to data from 2022. But basically, the rest of the data, according to current data, it shows a pretty green map, as it was presented by the first speaker. So. But we know that, and also the report acknowledges that this is not enough. So the second part of the report, what includes is, I'm sorry, and I was forgetting about all three, about a zone, is basically the most worrisome issue for the government. We do have a recent protocol, and so it is, of course, that is justified by the government. That it's a very complex, it's the more complex topic to an obstacle to overcome, especially in the case of Spain, heat waves and high isolation, and it's still one of the main obstacles and to overcome. So seems just few reductions, but it's recognized it's an increase worrisome, especially when it comes to the second part of the data reported by the government, that this time it is compared with the WHO guidelines. In the annexes, it is compare the contaminants, and the analysis there compare with EU limits and WHO thresholds for 2021. So if we had the green map before, now everything is red. So the good thing about it is that this analysis is also done by the government and presented the numbers, and just for you to know, NO2 is exceeded in the 84 and 95 zone respectively, covering 51.3 and 72.3% of all area measured. The annual PM10 value is exceeded in more than 118 areas, representing more than 88. And in the case of PM2.5, the value established by WHO is exceeded in 93% of the Spanish territory out of 121 zones. And of course, all three are exceeded in all zones, okay, or all zones. So you can see in the report that the column with the EU limits is green, and with WHO, everything changed, the perspective changed. So, it is 100% acknowledged about the need to change the current thresholds that we manage. So, with this, basically, under the Spanish presidency, what is being very much our advocacy coming from the very beginning of this year, as I mentioned to you, is coming from health and climate change. The priority has been basically to incorporate Spanish as holding the presidency, trying to push as much as possible for the directive to move forward and to get it approved before the elections. And especially when now it happens the trialogue and between the Commission, the Parliament, so Spain has a role to play. So I mean, I don't have to tell you how difficult is the complex is the political situation now in Spain. We have a prime minister in function, interim prime minister, would say. So it's let's see what is coming in the coming months, hopefully, and we will have the progressive again running another mandate, but we will not know until at least November. So, but what we do know is that, and it has been published already, is that the priorities under the EU presidency is one of them. The second is to advance in the green transitions and the environmental adaptations. These are basically the four blocks that and main areas where the EU presidency is going to focus. But this is okay. But this is too much. So how we land all these? It is included in the case of green transition. It's to combat the effect of climate change at global and European level. It's they very much focus on the electricity market reform, very much focus on to boost the decarbonization of the EU's economy and foster the green economy. But in terms of air quality, do we have any commitment? This is what we can extract from the Spanish EU program, is that Europe must spearhead initiatives such as improving air quality and applying an ambitious policy to control and restrict the use of hazardous chemical substances in manufacturing. This is with the zero pollution goal. This is what is being stated since officially Pedro Sanchez has not visited Strasbourg yet, but it's supposed to happen sometime at the beginning of October. But this is what it comes out of the EU documents presented by Spain. The upcoming events foreseen. This is just for you to know that several events are going to regarding environment and air quality and mobility are going to happen in Spain, especially in we do have the environmental councils in October and December, but we do have a couple of events in Barcelona and Seville, and so I think that. Before I close, I just want to highlight some recommendations, and most of them have been already mentioned. First of all, we do need research in the case of data regarding air pollution, because it's a national level. In the case of countries like Spain, where we have specific regions and cities where the plans have to be really definitely much more restricted, it demands data at a local and regional level. And this is something that has been raised by researchers, has been raised in many advocacy actions. So it's something that I really wanted to highlight. Then to mandatory regional and local air quality improvement plans, as I said, it is stated in the legal framework that it needs to happen, but it needs to happen with air quality plans with clear objective, which is something that it doesn't happen in most of the occasions. A structural measure to reduce emissions. To work with trying to work on trying and to reach the populations, and and to open the conscience about the need to everybody to assume its responsibility regarding air pollution is good, but this it really needs to put in force a structural measure that most of these plans just do not include. And then mechanisms to ensure the follow-up. These are these are questions that we've been raised and we've been demanding to the government. And at the same time, with the legal statute, we need also budget allocations and measures which can be implemented nationwide, and also regions and city councils. And of course, the air quality improvement plans for zone, as I said, is a very worrisome topic back here in Spain. And we hope that Spain plays a role with the new directive and push it forward. So I'm going to leave it here, and if it's okay for you.
Thank you very much, Irene, for this overview on Spain, both when it comes to the activities and priorities foreseen under the Spanish EU presidency, as well as showing us the picture of how concerning the air pollution still is in Spain. And we've all heard of the several heat waves that gripped Spain this summer, and from everything that we're now seeing on how heat and air pollution interlink for health, I think this is even more reasons to become active. Thank you very much. We're working towards the end of our webinar. Before we come to the final presentation on what needs to happen, I have a quick question for our panelists as on a topic that hasn't yet been raised. We've heard a lot of information this morning, and I wanted to ask our panelists about information to the public, to sensitive groups, and alerts, as this is a key topic that we all know from our working with the health sector or working with people, is about the information. You're all aware of the various air quality indexes that exist already. Back in 2018, the EU Court of Auditors, they've done a review on EU air quality action, and they found that unfortunately, when it comes to informing the public and sensitive groups, what we're seeing across the EU is very patchy. It's very different how it's being applied from city to city as well as country to country. The same goes for alerts. We currently don't have a mandatory alert for particulate matter as part of the EU rules. This is something that HEAL and other health groups are working towards a harmonized system. So I wanted to ask our panel here if you have any recommendation when it comes to information, or also any good practice that you can share as part of the webinar this morning. Yeah, and I'm now going to call on Zorana to see if you, from your perspective, you want to share something there. Thank you.
Well, I don't have good advices how to go, other than point out to what you said, that there's definitely need for better information or better synergy between different information systems. I think this is definitely the area we have not done well enough, because what's existing now is patchy, quite different between the countries. We haven't been very good at sharing that experience, learning from it, and there are definitely different needs across different countries, and there are different level of transparencies in different countries and areas, especially where air pollution is the biggest problem, as we see in Eastern Europe. So I agree with you that we should work better together to harmonize, share experiences, and be better to inform public, both of the levels and the health risks.
Thank you very much. Andrea, Veronica, or Irene, would you like to quickly share something from your country? Okay, I don't see. So we can leave it there, and also encourage you, all of you, to come back to this topic after our webinar. And back to you, Tomasz.
Yes, thank you. Now we come to the last part of today's webinar. So the way forward, what needs to happen, right? And I would like to present Sophie Perrault, HEAL EU Policy Coordinator. Sophie is coordinating and providing guidance for health engagement and advocacy on the revision of EU clean air standards. So please, Sophie.
Thank you so much, and very, very honored to be here this morning. And it's a bit difficult to be between you all and your lunch, so I will try to make it as as clear as possible and as direct as possible. So normally you should see my screen now, and there we go. The bridge. I hope by now you feel you are part of that bridge, and it's a big bridge in reality, because in reality, it's a big community. It's even a growing community that is calling for clean air for everyone. So for everyone's health, and this very much echoes what the health ministry said at the beginning of this webinar. So that I quoting what she said, to ensure that clean air is not a privilege. So what is the way forward? If there's one thing to remember about the way forward, it is this. It is about legislation. So what we call the European Union to do is to urgently, finally, and fully align EU air quality standards with the latest available science to protect our health, because the legislation we currently have is outdated. It is not aligned with the latest science, and it's actually almost 15 years old. The change is now. No need to repeat it. You heard it very clearly. Air pollution harms our health in a variety of ways, and maybe something you heard, and I would like you to really remember as well, is we are all vulnerable to air pollution, and air pollution makes us vulnerable. So this is very, very important to keep in mind. A little focus on what Professor Anderson called the garbage container. So particulate matter is the pollutant with the greatest health impact. So this is really important to remember as well, for a variety of reasons. And so where do we go from there? We are all on this bridge. What is the horizon? What is the road? And what is the timeline? The road is a health transition for EU clean air. So this is what we are on trying to do right now. And this didn't start today. This started already when the WHO new guidelines were published almost 2 years ago. And so the horizon we are working towards is 2030. It's actually really now the change needs to happen. And change we are calling for comes in 3 main points. So point number one, absolute number one, increase the level of ambition of EU legislation on air quality. This is absolutely number one. What does that mean? It means two things. It means, first of all, fully align the EU air quality standards with the WHO recommendations and the latest science, because we heard that there's even more latest science ever since. By when? By 2030. And I really insist by 2030. We have no time to lose. We are already late. What it also means, increasing the level of ambition, it means setting legally binding limit values. So this is the tool in the European Union that is driving air pollution down. So this is an absolutely key element in what we're doing, setting the right legally binding limit values. And by doing that, we are doing something extremely important. We are addressing health inequalities. You have heard about environmental health inequalities. Yes, clean air is about health equality as well. So on our website, you will also be able to see our position paper in various languages. One point as well that probably resonates with a lot of you is about vulnerability. Everyone, all of us are vulnerable to the impacts of air pollution. And indeed, some of us are more at risk. What does that mean? I would like to pause a second because it needs to be really clear what vulnerability means. Our level of vulnerability is something that evolves. It can change. It can change with age. We all are aging. It changes with our health conditions. That is also something that is not stable. It can totally also change with our socioeconomic status, because that is also a variable, right? And it also changes with where we live, where we study, where we work, or even more. So this is really, really important to keep in mind. Everyone is vulnerable, and this is about all of us. Point two, so after the increase of the level of ambition, and at the same time, number two is to protect vulnerable groups, to protect everyone. This is the smartest way. If you want to protect everyone, produce a legislation that protects really the vulnerable groups, then you are sure that you are doing what is needed. What does that mean? That means at least two things. We need to define exactly what a vulnerable and a susceptible group is. So this is very important to be clear on the definition of what that means. And at the same time, we just mentioned it briefly a minute ago, we also absolutely need to strengthen the requirements for accessible, transparent public information on air quality. So this is how we want to change the ambient air quality directives. And third point and last point of how we want to do it, what is the road? The third point is to ensure the most health protective enabling framework. A legislation is only as good as it is implemented. So implementation and how this is being implemented is absolutely necessary to be closely looked at. Three elements. We do not want loopholes. So what does that mean? We need to close the risk of compliance delay and exemptions. This is not a minor item. This is very, very important. And this is what legislation should be about as well. We also don't want our legislation to be outdated because we heard already the current legislation is obsolete. I'm quite Professor Anderson. So what we need is to support an independent review of evidence regularly carried out by the WHO at the core of a so-called review mechanism. And third, very, very important point as well, and we also heard it already, we need to increase the density, so more, and representativity of monitoring stations. Yes, we need data. Data is very important. So this is how we really need to change the legislation, the ambient air quality directives, not in 10 years down, in a few hours from now, because in a few hours from now, in less than a week, there is a very important vote exactly on this legislation in the European Parliament in Strasbourg. MEPs, your representatives are voting, so they need to hear from you that you are really calling them to change this now, because the window of opportunity doesn't open every morning, right? It opens very rarely, so the time is now, and we're all engaged, and it's not over. So what we're looking forward to is to have science-based EU air quality standards, and this is what will lead the way. So the way forward lead the way for healthier air everywhere. This is very important. We also heard from various member states, from various countries. We are all subject to the same laws when it comes to air pollution. This is also something that needs to remain. And I would like to end, so this is the last slide of the presentation from my side now. I would like to end by actually, amplifying the voice of somebody who lives with very severe asthma and who absolutely has a strong voice on air pollution. So what you see here is an extract of an interview with somebody called Dominique Hammerling. So you see her on the picture. This is very recent. That was published a few weeks ago in August by the European Lung Foundation. And so, they spoke with her and they asked her a few questions. And basically, I just want to read it to you because it's so important that it resonates and stays with you. So can you tell us how your health is impacted by air quality? Air quality impacts me, my life every day. At the start of any day, I check the levels of pollution in order to set an expectation of what I might be able to do. However, this is not often stable. Air quality changes during the day and unexpected things can happen. I can be okay one moment, but then completely breathless 10 minutes later. This is real life. This is happening right now, and this really needs to be taken care of. What adjustments do you need to make to a daily life when air quality is poor? When the air quality is very poor, I cannot leave my home. I spend my day breathing while sitting on a chair. Most other activities are too much for me. I need to take the absolute maximum of my medication just to get through the day. All my energy is spent on breathing. All my energy is spent on breathing. So final words, what are your hopes for the future regarding clean air in Europe? So what Dominic hopes is that the new EU Ambient Air Quality Directive is accepted soon, so really urgently soon, and that the levels that the WHO proposed are accepted and will become the standard as soon as possible. This is in everyone's interest, but especially for people who are already vulnerable. We need to be able to breathe air that does not negatively impact our lives with every breath. Thank you very much.
Thank you, Sophie, on such concrete and straightforward presentation on the way forward. I think the next week is a really important week, and let's see what we'll have after that. So anyway, also big thank you also for all other panelists who shared the insights on air pollution, and also insights on the country level. Last but not least, I would also like to thank you to the audience who participated on this webinar. And if you missed any part of the webinar, you know, as Anne explained before, video will be available online. Anything else, Anne, I forgot before the lunch break?
Thank you, Tomasz. Thank you also from my side to our speaker. Thank you so much for your insightful for your insights and all the knowledge you shared with us. And we very much hope that this was part of building the bridges. Thank you to our participants. Thank you to our translators as well for again helping us to make new connections and more connections. Thank you also to the teams of HEAL and the Institute for Health and Environment behind this, who made sure everything went smoothly and we could have this exchange. And as you said, Tomasz, last but not least, thank you to all of you participants. It was a pleasure and an honor to have you with us this morning, and to know that we're all together. We're working together for clean air, so that we're building the bridges, we're walking the bridges, so that really that we can all soon breathe clean air everywhere. Thank you very much, and have a good rest of World Clean Air Day. And indeed, you can watch this webinar soon, and please help us to spread it in your channels.